All right.
Now the floor is yours, sir.
All right. Thank you. It is 9:30. We'll call this Long-Term Care Committee of Management meeting for March 15th to order. Welcome, everyone. Just to remind the elected officials of their obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare at that time. Our first report this morning is the long-term care CM 0422 regarding the long-term care operational report dated December 15th, 2021 to February 14th, 2022 be received for information. Can I have a mover for that, please? Moved by Barb and seconded by Dwight. Jennifer, I believe you're taking this one.
Great, thank you, Chair Mackey. This report is, as you said, our operations report for the period of December 15th to February 14th. And as we have historically, each of the EDs and specialists are going to hit the highlights of the report. And at the end, if there's any questions about anything specific, we're happy to answer those. So I'm going to pass it over to Renata to start us off on quality.
Thank you.
Thank you. Good morning, Renata.
Good morning. Good morning, everybody. And to start off with, the Canadian Institute for Healthcare Information has not released an update since the last report. The next update is expected to be released later this month. Attached to this report is a link to a new website launched by the Ontario government called Long-Term Care Home Finder. This website allows prospective families and residents to compare long-term care homes across the province. On the website, you will find the number of beds, a wait list, vaccination rate, along with inspection reports dating back to 2010. Also attached to this report is the annual resident and family experience survey results for 2021. The overall average is 91% for residents and family for quality of care and would recommend the care communities to others. The resident experience survey results showed that the top words used to describe the care communities are good, caring, excellent, friendly, and comfortable. And the areas of top satisfaction are room and the surroundings, quality of nursing care, and feeling safe in their surroundings. The top areas for improvement are offering things to do, physiotherapy, and meals appealing and tasty. The teams are currently reviewing their own survey results and will be used to develop the 22-23 quality improvement plans. Attached are the overall Grey County resident and family experience survey results. Are there any questions?
Questions from committee members? I'm not seeing any, Renata. Those 91%, that's a very good rating. So congratulations on achieving those high marks from the consumers of our service. I suspect our wait lists will get longer after that. Sorry, Barb, go ahead.
Thanks, Mr. Chair, and good morning, everyone. Checking out the things that might need improvement, being tasty and appealing meals must be a significant challenge because it's so subjective, depends on individual tastes, and also institutionally prepared meals. And I'm just really curious, how would you go about looking at that, even beginning to come up with a scenario or a path to make a change in that direction?
There are a few things that we can take a look at. And one of them is how meals are presented and the service of what the plate looks like. So what you see and how appealing it is. The other thing that we do is we take the menus to a food committee and have the residents of the food committee take a look at what's being offered and offer suggestions on what other things alternatives could be offered from the menu. Shannon, I'm actually looking at the square to you because you and I have done this over the years. Do you have anything else that you could add to that on how we make it more appealing? I'm sorry, I put you on the spot, Shannon. Oh, you're
Yeah,
muted.
go ahead.
Sorry, I thought I had unmuted myself. No, I think exactly what you said is what we would start with anyways, and get the residents' input on what they would like different on the menu and just go from there. And definitely how it's plated and how it's presented is a big part of it as well.
Thank you.
Shannon, are there any choices at mealtime?
Yes, we have choices at all of our meals and at our snacks as well. So they have 2 choices of everything. So there's 2 entrees, 2 vegetables, 2 starches, and then definitely 2 desserts.
Thank you. Christine, did I see your hand up?
Yes, thank you, Mr. Chair. Good morning to everyone. Just remind me, it's been just a bit of time. Do we have any community gardens at any of our care communities? And if that, just provide some feedback on that, if you might. Thank you.
Did you want me to?
Who's going after that question?
Yeah.
Shannon, go ahead.
Oh, sure. Well, through you, Mr. Chair, if I might.
Sorry, Jen.
There have been, I'm not sure exactly during COVID where the gardens are, what the status of the gardens are, but I can speak for Grey Gables. There has been a shared community garden with the Southeast Grey Community Health Center that it backs on to the property of Grey Gables, that they had a program of a community garden, and it was on site at Grey Gables, and there was some opportunities for residents and patients of the clinic to meet together and do some gardening. And over the years, there's residents that have a passion for growing different things. And when I was at Grey Gables, there was a resident who loved to grow tomatoes. And so we always had a nice harvest of tomatoes at that whenever it was time for tomatoes to be ready. So I think it depends on the interest of the residents, but the courtyards and the spaces at each of the home offer an opportunity for raised garden beds. The backyard of Grey Gables offers this opportunity for a broader community garden. It's something that's being discussed in the redevelopment plans at Rockwood Terrace, is where would those shared spaces be, and how might they be a community focal point. But most importantly, it depends on the interest of the residents. If there's nobody living at the home that really has a green thumb and loves to garden, then it's the staff gardening. But if the residents are interested, then we're able to help support that. And I don't know if any of the EDs have anything else that they wanted to add to that. Stacy?
Through you, Mr. Chair, I'll just add that I know certainly it always comes from a resident interest, but here lots of people have their own individual palette for herbs and things. So that was always something that we did here through our garden, was plant herbs, and then they would have picnic lunches and they could cut them up and add extra flavor to their meals and things. So yes, it's certainly something that's resident driven, but we actively do here as well.
Thank you, Mr. Chair.
Yes, go ahead, Christine.
And I thank you for those comments. And I really see the synergy of entertainment, perhaps, or activity, as well as maybe more a tasty meal. So thank you very much. It's quite encouraging and quite exciting, considering we're coming up to spring when we plant all the seeds. Thank you.
Great. I'm not seeing any other questions. Renata, are you done your section now?
Yes, I am. Thank you, Mr. Chair. Yes.
All right. Thank you. So maybe we'll go to Lee Manor now. Stacy, you've got the floor.
Thank you, Mr. Chair. So I'm going to provide an update regarding the ministry compliance. And last fall, it was announced that Ontario would be launching a new and improved inspections program for long-term care. And Lee Manor was actually one of the early recipients of this new program. We had 2 inspectors here the last week of January and the first full week of February. And they completed what's called an annual proactive compliance inspection. It was quite extensive and it involved 13 inspection protocols. It also involved interviews with our staff from various departments, our resident council and family council president, as well as interviews with residents and family members. In addition to that, they also toured the home, observed resident care, our dining service, medication administration, resident and staff interactions, as well as our IPAC practices, and reviewed numerous clinical records. So we're very proud that at the end of this quite elaborate review, we were left with just one area of non-compliance that was related to our window openings, which a few were found to exceed more than the 15 centimeters. So the windows were immediately repaired and met the compliance standard before the inspectors actually left the building. And we've put measures into place now to ensure that there's ongoing compliance. And at the end of this process, inspectors will actually meet with some of the leadership team to do what they call an exit interview. And they just kind of do a very brief summary of their observations. And I just wanted to mention that the inspectors were very complimentary, not only of our building here. They quite frankly couldn't believe that it was built in 1973. So we obviously take great pride in maintaining the home. But they were very impressed with our staff because while this full inspection was going on, we were also managing a COVID outbreak in one of our home areas. So you can imagine that might cause a little bit more angst in the building. And they were quite, they just noted how remarkable their staff were under the circumstances. So it was really nice to hear not only were we managing a COVID outbreak, but fared very well through the process of an inspection. They even mentioned, how calm and confident the staff were in a stressful, what would normally be a stressful environment. And they were very impressed with their IPAC practices. And they said, you have good habits when even the residents are going in and out of dining rooms and just naturally sanitizing their hands. So we're very proud of the results. It was a stressful experience, but definitely a learning experience, and one that I think has given us greater confidence and more team unity together. So it was great. So if there are any questions about that.
Congratulations, Stacy. Any review like that certainly is stressful, but congratulations on the very positive results. Questions from committee members?
Thank you.
You got
I'm guessing that Chair Mackey's internet has interrupted at this point, so I'll pick up until he returns. Chair Mackey, are you there? Okay.
here, yes.
So please go ahead. Pardon me.
Sorry, that was Stacy. That was it for your report, correct?
That's correct. Thank you.
Okay, thanks. Sorry, Christine, did you have a question?
No, Chair Mackey, I was just ready to jump right in there if you needed the vice chair, but you've got it. So thank you so much.
Thank you. We'll now turn it over to Rockwood Terrace. Karen, the floor is yours.
Thank you, Mr. Chair. Good morning, everybody. I would like to just touch briefly on the people section because we've been very fortunate to have at least 4 and another one on their way, another care support assistant on their way to becoming a PSW. So if you recall, about 2 years ago at this time, we were successful in getting this classification of care support assistant into our collective agreement. And at that time, it was purely to assist with PSWs mainly, but also any areas of that home where we needed some extra help. and turned into be quite necessary as we entered the COVID pandemic, and they helped with screening and everything. One of the unintended impacts of that classification was growing our own PSWs. So it's very exciting to see that come to fruition. We started with about 13 CSAs, and 5 of those have gone on to be a PSW. And I know the other 2 homes have had success in this regard too. So it was extremely pleasant outcome, and we're happy to have them. And a lot of them were able to go right into full-time PSW lines. So even better for them. Also just wanted to note there are efforts as far as recruitment, even through the winter months when all of us were dealing with outbreaks. We managed to squeeze in some interviews and onboarding of new staff. And I'd also just like to note the HR generalists that have joined the team. And I believe, and maybe Jen Moreau can speak to this a little bit more, but they have created a long-term care recruitment team to help our efforts there, which is very much appreciated and hopefully will help us move forward as we enter the summer months with et cetera, to try and get our staffing levels up to where we would like them to be. So we're very appreciative of our HR folks, and just wanted to highlight that today.
Thank you very much, Karen. I think I maybe better turn the chair over to Christine, because I am not seeing anyone other than Karen on my screen. So Christine, if you don't mind taking this.
Yep, not at all, Chair Mackey. I don't mind. And at any point when you want the chair returned, again, not a problem. So let's continue. Jen Moreau, please go ahead.
Thank you so much. I just wanted to expand on what Karen had discussed about the HR business partner focus on long-term care. We do have 2 folks now that are helping within long-term care from the HR team. We have 2 HR business partners. One is focused on Lee Manor exclusively, and the other is focused on Grey Gables and Rockwood Terrace. And the 2 are working together to streamline our recruitment processes and get the word out for every level of college and every avenue that we can potentially pursue to grow our own and color it our way for recruiting for the long-term care homes. We did see a dip at Christmas time in recruitment on resumes coming in, but we believe we're back up to normal status, and the team is just trying to reach everyone that we can to expand our staffing resources.
That's incredibly exciting, and really to put a spotlight on long-term care careers and PSWs, I think is quite amazing to put the just the focus on that. Thank you. Jennifer, did you want to put any other comment before I go over to Shannon? No? Okay. Good morning, Shannon. Please go ahead.
Good morning, and thank you. So I am going to be reporting on our Color It stories. All 3 care communities acknowledge that 2021 was a very challenging year, and 2022 has just started. The homes have had to adapt and adopt to a different way of operating the homes and providing the Color It spirit. Each care community has received lots of expressions of gratitude and appreciation to all of the staff for enhancing the lives of the residents. Morale boards have been put up that feature photos of residents with motivational messages, and on the walls are some inspirational resident artwork. Rockwood Terrace would like to invite you to all to view the 1 second of every day 2021 edition, where the residents are showcasing many of their highlights and fun that they had in 2021. The presentation is linked in the report. Thank you.
Fantastic. Any comments or questions? Scanning the gallery here. Wonderful. Is there anything further on this particular item before I call the question on it? All right, you have the motion before you. Any questions on the motion? So all those in favor indicate with the raised hand then. That motion carries. Thank you very much. Welcome back, Chair Mackey. How is your internet? Oh,
Right now, it seems fine, but just continue on. We'll see how it goes for the next 5 or 10 minutes. Thank you.
okay, you're welcome. So we're on 3B, and that is LTCRCM 0522 long-term care COVID-19 update. And to put it on the floor, the motion is that report LTCRCM 0522 regarding a long-term care COVID-19 status update be received for information. Is there a mover for this motion? Councillor O'Leary. Is there a seconder? Warden Hicks. Very good. Over to you, Jennifer, I believe.
Great, thank you. So this is the update that we've gotten into the habit over the last 2 years of providing a COVID update. We do our best to have it be the most up-to-date information, but a lot has changed since this report was drafted only a week ago or so. So I'm going to hit the highlights, and I'm going to summarize what was done in terms of this report, and then give you a verbal update on what the status is today, because there has been some significant shifts. So March 10th marked the second year of the pandemic, which is a little bit hard to believe, but that is how it is. And over the past 2 years, there have been numerous protective measures and strategies implemented in our long-term care homes and in our communities. The counties of Grey and Bruce experienced the highest COVID-19 case count to date during the months of December and January, and our 3 homes felt the effects of that 4th wave. It was the most challenging time yet for our residents, families, and our team members. The updates and summaries of the outbreaks are listed here. I'm not going to go through them in detail. All team members at each location worked quickly to implement enhanced IPAC measures and worked closely with our public health partners to contain the outbreaks. Health status reports were provided daily to families of COVID positive residents by telephone. So staff made that a commitment to phone the family members of residents who were positive with COVID-19 to give them a daily update. And that was really appreciated by families and residents. In addition, general updates were provided daily to the community through our email system, the MailChimp, as well as to designated care partner email contacts. Daily outbreak management meetings were held with public health and with the support of DENA, our clinical specialist. And IPAC audits were conducted daily, additional supports were utilized, and leadership teams activated their 7-day-a-week rotation in order to provide leadership support every day. Vaccination update. There's been numerous changes in terms of kind of tweaking of the deadlines of vaccine mandates, and they're highlighted here. I would like to note that on March 9th, the Ministry of Long-Term Care released their most recent ministry update, signaling the transition of government-mandated vaccination to shift to employer policies. And Grey Long-Term Care, in partnership with our human resources partners and senior leadership team, we are continuing with the mandate of fully vaccinated, so 2 doses plus the booster. So we're continuing with that as our policy. So and that's for all staff, students, and designated care partners. At this point, it's approximately 35 employees across the 3 homes that still need to have their 3rd dose of vaccination to meet the policy. The date for that is March 21st. We will continue to offer vaccinations on site, meet with each of those people individually to provide support. Ultimately, however, they need to be vaccinated or their employment will be terminated. Moving on into surveillance testing. During the outbreaks, we experienced delays in lab results. During outbreaks, one of the strategies was frequent PCR testing to support, having a sense of what the containment efforts were in the outbreak, trying to get ahead of who needs to be isolated for how long, and trying to contain the spread. A delay in lab results makes that really challenging. So collaboratively, one strategy that was approached is paramedic services and long-term care department working with Ontario Health to acquire an ID Now machine, which is a molecular testing device to detect COVID-19. This is now on site at Rockwood Terrace. There's some significant training that goes along with it. And, we started this in the middle of that outbreak, and we are now at a place where we can run those tests on site. And so you get a test result in 15 minutes that is more reliable than a rapid antigen test, not quite the gold star of a PCR, but somewhere nice in between that just helps with that management of outbreak. And so that is on site now, and we're continuing to work through the processes in how we can utilize this in outbreak management for outbreaks that are not just COVID, perhaps influenza, RSV, other types of outbreaks. This is pretty unique. I believe that we're one of a small, if not maybe the only, long-term care homes in the province that are working with this. There may be some long-term care homes in the far north that are also going through this process. So it's exciting, and I think it ultimately benefits the residents in terms of decreasing unnecessary isolation and allowing team members to quickly respond to outbreak. Just to add to surveillance testing, as of today, we will continue to do daily or every shift, every visit, rapid antigen testing as part of our surveillance measures and our protective measures over these next few weeks. We will assess that as the de-escalation of strategies continues over the next few weeks, but for now, we're keeping that in place. The next section highlights visiting and leaves of absences, and you can see that there's a number of iterations of changes to the visiting and absences during this reporting period. I'll just focus on March 14th. That target has become in effect as of yesterday, and so there is a resumption of visits by general visitors under 5 years old. So, of course, children 0 to 5 are not eligible yet for vaccination, and so they have previously been excluded from visiting. They are now permitted. They also are required to be tested, rapid antigen tested when they visit, actively screened, and wear a best fitting mask. We have sourced really economically some child size N95 masks to support the children visiting to be as safe for them and for who they're visiting. And then in addition, social overnight absences are now permitted for all residents regardless of vaccination status, and increasing the limit on the number of visitors up to 4. So those are the changes that came into effect yesterday. A virtual family meeting was held on February 10th, and there is another virtual family meeting scheduled for tonight at 7. We tend to get anywhere from 40 to 80 people joining those calls. They last from 7 to 8. They almost always take the full hour. I give an update, and Dana joins the meeting as well. And then we do a Q&A. We appreciate our support from our communications team. Olivia and Rob have both supported, and we get a lot of really great questions that help us check in on, are we on the right track? So we think we're doing the things that people want, but it's best to hear from families as to what's important to them, and this is a really great tool for that. And I plan on keeping the virtual family meeting format in for different things like redevelopment. And I think it's a great tool to engage with people. IPAC strategies. So we implemented, as I mentioned, the daily rapid antigen testing and N95 mask and eye protection. We use those universally as source control. During the outbreaks, we continued with N95 Mask Fit Testing as the supply of N95s were limited, and so now we have a good supply of a couple of types of N95. So we needed to make sure that all team members were fit tested to the N95 masks that we can get. So that has happened. For today, as an update, as of today, I just want to let the committee know that we are planning a de-escalation of some of these protections. So as of March 21st, team members, students, volunteers, and designated care partners will have the opportunity to make a choice of what type of mask they use. So the minimum standard on March 21st will be surgical mask, but people can have a choice. So we'll go over and talk again about point of care risk assessment, people's comfort levels. And so N95s will continue to be available, as will eye protection, and it will be up to the individual to make that choice in terms of their comfort level and what type of interaction they're having with residents or what their situations are. Designated care partner program, it continues to grow. And just a note that the designated care partner program will be presented at the Advantage Ontario's annual convention in April and features 3 short videos of designated care partners telling their story. It's really exciting and really moving to hear how this program impacted them and how important it was to them. So that's really exciting. A short staffing update. A number of the 19 long-term care homes in Grey Bruce in our area have experienced an increase in staffing challenges, particularly during the recent Omicron surge. It was identified that there's a need for a long-term care emergency response team. As a part of the response team, staff would be deployed to assist the homes in a crisis situation and assist with a number of duties, allowing nursing staff to focus on resident care. So the long-term care committee, which is made up of leaders of those 19 long-term care homes, have worked collaboratively with the YMCA Employment Services and funding from Ontario Health West to create a team and work through the orientation requirements. Utilizing Grey County's e-learning platform, we've provided the mandatory orientation education for over 30 individuals who are ready to be deployed when needed. And we're also looking ahead to see how this program that was an emergency crisis, that's what it was born out of, how it might evolve to supporting individuals who may be interested in a career in long-term care, so that people that have had a chance to put their hand up and say they're willing to do short-term crisis work, maybe they're interested in more longer-term work. So we're looking at opportunities to evolve that program. Recovery and wellness, and we've talked about this a few times over the past number of months, and just wanting to highlight that this is it's an important topic, and our team has been talking about how we put a priority on recovery and wellness, and that we really look at the work that we do with a wellness and recovery lens. And how can we apply wellness initiatives to the work that we're already doing. The province has confirmed additional COVID prevention funding for the remainder of 21-22 fiscal year, and the breakdown is listed here. And our partnerships continue across the region. And just before I close, I do want to just comment on we're at a bit of a crossroads in terms of what may or may not happen in the coming weeks with the de-escalation of strategies in the broader community. So while that's hopeful and promising as mask mandates lift and capacity limits become more expanded, it's also causes us a bit of a pause in terms of what might the unintended impact be. And there is the potential that there could be another wave of increased number of COVID. It could impact our homes. And so we have already, as a team, been planning and talking about what we might do. So while the de-escalation of strategies is happening, we're not removing them all. So we continue to have a good PPE supply on hand just in case, and if necessary, we'll upgrade to the N95 masks again universally. We continue with predictive scheduling, which is where we look ahead and attempt to increase our staffing levels in areas where we are historically working shorter in staff or struggle. Continuing with the daily rapid testing, continuing with close surveillance of residents and team members in terms of symptoms and being supportive in that way, and continuing with our vaccination clinics. So it's hopeful, but I don't think we should let our guard down quite yet. And we just need to take a slow approach and be prepared to respond if, in fact, there is an increase in cases or potential outbreak. And that is my summary. Thank you for your patience.
Thank you very much, Jennifer. Slow and steady is what I'm hearing, but I really just want to appreciate the detail that is presented in the report and in your presentation. And it's just amplified in terms of the innovative work that's being done and the strategies that are being creative to address the challenges that the pandemic has presented and the care that's taken to our care community. So just thank you very much to you and your team and all the associate staff that come in to support long-term care. We're forever grateful, for certain. With that, are there any questions with regard to the report that was just presented? Okay, I'm just scanning to make sure I don't forget anyone. I do want to say good morning to Councillor Woodbury, who's here. Chair Mackey.
Thanks, Madam Chair. Jennifer, thanks very much for the report. And I just wanted to echo Christine's comments. It's very apparent, getting through the Omicron wave that it was a team effort throughout our long-term care facilities. Seeing the work that the designated care partners provided, feeding residents and providing support to residents. It's really heartwarming, as well as our paramedics and all the staff that pitched in and did extra shifts. So congratulations to everyone on the call today for a job well done getting us through that last couple of months. Thanks. Just one question in regards to, and maybe this through the chair is for Jennifer, in regards to our vaccine policy going forward. Jennifer alluded to the changes that are occurring on seems like a daily basis now. Is our vaccine policy going forward, is it the same as what the hospitals and other long-term care facilities are using?
Jennifer?
Sure, thank you. And I wasn't sure if you meant me, Jennifer, or Jennifer.
I think I meant Jennifer Morrell.
Okay.
Oh, pardon me, Jennifer Morrell. Thank you.
Through you, Chair Mackey, I have a feeling Jen and I would have said the exact same thing. We have surveyed, and by we, I'm going to say Jennifer, because she has been in close contact with her network partners across long-term care. And we believe the majority of long-term care facilities, and by majority, I'm thinking at least 90%, are following the same suit as we are, which is maintaining our vaccination requirements that we've had in place all along. It's our duty to protect our staff and our residents. And as far as Grey Bruce Health Services, I believe that their intention as well is to carry on with their mandatory vaccination policy. I haven't received that in writing, but I believe that the intent of folks in high-risk settings is to maintain our policies and have a united front and ensure that we are taking every precaution reasonable under the circumstances for staff and for our residents and visitors.
Thank you.
Are there any other questions from the committee with regard to this presentation? Okay, to the motion at hand, which is that the report LTCR CM 0522 regarding the long-term care COVID-19 status update be received for information. All those in favor indicate with the raised hand, please. All those opposed, the motion is carried. Thank you. We're now moving on to item 4, which is closed meeting matters. So the motion that we have before us is that the Committee of Management does now go into closed session regarding the long-term care operational report pursuant to section 239 sub 2 of the Municipal Act 2001 as amended. The reasons for it, number 1, personal matters about an identifiable individual, including municipal or local board employees. And number 2, labor relations or employee relations. Is there a mover for this motion? Councillor Burley, and as seconder, Councillor Clumpus. Are there any questions with regard to the motion? All those in favor indicate with a raised hand. All those opposed? The motion is carried. We now go into closed session.
One moment.
Well,
Thank
just
you.
for Olivia, I will note that all staff will remain in attendance during this closed session.
Thank you.